Studies suggest that eating berries every day could reduce arthritis pain, improve joint function, and even lower inflammation markers in your body. But is it really that simple? How much do you need to eat, and can berries actually replace other treatments? Hey everyone, Dr. Jeff Peng here. I'm a sports medicine doctor, and I've helped countless patients manage their osteoarthritis symptoms with evidence-based treatments. Today, I'll break down the science behind how something as simple as eating berries every day can significantly reduce joint pain and improve overall health. One of the primary drivers of osteoarthritis is chronic low-grade inflammation. While traditionally viewed as a wear and tear condition, recent research highlights the significant role of inflammation in its development and progression. For instance, inflammatory molecules like IL-1 beta and TNF-alpha are often elevated in osteoarthritic joints. These signaling molecules not only promote cartilage breakdown, but also inhibit the natural repair processes needed to maintain joint health. Studies have also shown that individuals with metabolic syndrome, which include things like obesity, high triglycerides, poor cholesterol profile, high blood pressure, and abnormal blood glucose, experience higher rates of osteoarthritis and more severe symptoms in their joints. This is largely due to the low-grade systemic inflammation and the production of inflammatory molecules that wreak havoc on the body and the joints. And this is where berries come into the picture. Berries are renowned for their powerful anti-inflammatory properties and are rich in antioxidants, ranking among the highest of any food. These antioxidants help neutralize free radicals and reduce oxidative stress, which in turn suppresses inflammation throughout the body. This makes berries a valuable addition to any strategy aimed at managing osteoarthritis. And clinical trials actually back this up. In fact, there are two randomized controlled, double-blinded, placebo-controlled trials that highlight the potential benefits of berries in managing osteoarthritis symptoms. The first study focused on strawberries and their effects on knee osteoarthritis in obese adults. Participants consumed 50 grams of freeze-dried strawberry powder mixed with water twice a day. This is about 15 large strawberries twice a day, and they did this every day for 12 weeks. And the results were remarkable. Participants experienced significant reductions in key inflammatory biomarkers, including IL-6 and IL-1 beta, as well as cartilage degradation marker MMP3, all of which are closely linked to joint inflammation and tissue breakdown. Additionally, participants reported lower pain levels and improved ability to perform daily activities. The researchers conclude that the findings strongly support strawberries' anti-inflammatory and joint protective effects in knee osteoarthritis. The second study examined the effects of blueberries on adults with symptomatic knee osteoarthritis. Participants consumed 20 grams of freeze-dried blueberry powder mixed with water twice a day. This comes out to around 100 medium-sized blueberries twice a day, and they did this daily for 4 months. This trial also showed promising results with significant reductions in pain, stiffness, and difficulty performing daily activities. Gait performance improved as well, with participants walking more stably and confidently. Although inflammatory biomarkers like TNF-alpha, IL-1 beta, and IL-6 did not significantly change, there were trends suggesting that blueberries might subtly modulate inflammation by increasing anti-inflammatory markers like IL-13 and reducing MCP1, which recruits inflammatory cells to joint tissues. Both studies highlight how berries may benefit osteoarthritis through different mechanisms. Strawberries showed systemic anti-inflammatory effects, while blueberries demonstrated improvements in pain, stiffness, and physical function. These effects are likely driven by the high levels of antioxidants and polyphenols in berries, such as anthocyanins and flavonoids. These help neutralize free radicals and reduce oxidative stress, which is a key factor in joint degradation. Additionally, these compounds may inhibit inflammatory pathways like the NF-kappa beta signaling pathway, which is known to drive cytokine production and chronic inflammation. So while more research is needed, current evidence strongly suggests that including berries in your diet is a simple and natural way to reduce inflammation, relieve pain, and improve joint function in osteoarthritis. A common critique, however, is that Not everyone wants to buy strawberry or blueberry powders, and many people prefer eating fresh fruit instead. The challenge is that achieving the doses used in the clinical trials would require consuming a significant amount of berries every day. The key takeaway is that it's the anti-inflammatory effects of these foods that truly matter. Rather than focusing on just one type of food, the goal should be to incorporate a variety of anti-inflammatory foods into your diet for the best results. So what if we take this one step further? What if people adopt a full anti-inflammatory diet? Could this have an even greater impact on osteoarthritis? An umbrella review examined the effects of dietary practices on osteoarthritis symptoms, and they found remarkable results. The Mediterranean diet, a widely recognized anti-inflammatory diet, was associated with improved knee and hip range of motion, reduced self-reported impact and disability, lower pain levels, decreased biomarkers of cartilage degradation, and reduced inflammatory markers. All of this highlights the transformative power of nutrition. When you start viewing food as medicine, you open the door to a new path of pain relief, enhanced mobility, and a return to the activities that you love. If you're ready to take the next step, watch this next video where I break down the best anti-inflammatory foods to help you reduce pain, improve joint health, and reclaim your mobility.